Hello, this is Dr. Ford Brewer with Heart Attack, Stroke, Cancer, and Disability Prevention. We're going to talk today, pardon me, I'm going to get better images soon. Anyway, but we're going to talk today about diabetes and heart disease screening in the dental community. As you see from this image in diabetes care from the ADA, American Diabetes Association, periodontal disease is listed as the 6th complication of diabetes. In fact, there have been many studies about periodontal disease, and up to 50% or more of diabetes patients. You've seen this in other videos that I've done. This is the progression of periodontal disease, where you get going from healthy pink gums to more of a dark and black colored gum, and receding of the gum as well. That's what happens in diabetes, and that's what dentists are looking at every day when they go to work. This is more of a diagram of it, and you see basically you get inflammation of the vasculature and loss of the gum. Now, you would think there would be a lot of screening for diabetes and heart disease in the dental community. Well, sometimes yes, sometimes no. When's the last time that your dentist did your blood pressure? When's the last time your dentist asked you about diabetes even? When's the last time your dentist offered some finger stick glucometry blood testing? Actually, there are dentists out there doing all of these things these days, and some of them catch grief for it. We'll go into some of that, and hopefully this won't degrade into a rant. So here's my issue. This is I trained in doing this kind of stuff at Johns Hopkins. I'm not going to go into the detail on it, but it's screening tests, public health screening tests. We want to look for people that have disease, help them become aware that they have that disease, and then get them treatment for disease. Now, you've got a group of healthcare professionals, dentists, who deal with this on a regular basis. Now, what do they do in terms of screening? In doing a brief review on the internet, I did find a group called Glycaemia, I believe, and they have what they call a Dentists Against Diabetes program. That program for screening looks very interesting. It includes a packet of information, educational information from the ADA. It includes a history focused on questions around potential insulin resistance and diabetes. And it also includes some testing. I believe in looking at it that it's testing for blood sugar. However, I can't tell because they won't let you download the information until you sign up. Again, part of their goal is to help dentists increase revenue through this screening. I work with a good bit of the dentists in the country who are focused on oral systemic health. It's unfortunately a minority of dentists out there. In fact, if you talk to the dental community that's focused on oral systemic health, you'll hear them use the term drill, fill, and bill. That's what you sometimes end up, what some dental professionals end up doing, just focusing on finding a cavity, drilling it, filling it, and then billing for it, and then moving on. But again, there are dentists out there who are focusing on the larger health. One of them is Lee Osler. Dr. Osler actually developed a software program to help dentists look at oral systemic health. Part of the problem with getting dentists into oral systemic health is there's a lot of information to gather. his software package was developed to help lead docs and patients down a somewhat complicated path to collect the information needed to do this. Dr. Osler has also been, I believe he may have been a founding member of the Oral Systemic Health Association, AOSH, American Association for Oral Systemic Health. They're going to be meeting next month, September, in Salt Lake City, Utah. Again, a large group of dentists who are focused on screening for metabolic disease, diabetes, heart attack, stroke, vascular inflammation, which again they can see when they look at the gums of their patients. Here's another dentist who's been doing a lot of work in this area. His name is Doug Thompson. Dr. Thompson developed a thing called the Wellness Dentistry Network. And actually you can see, this is a picture of Dr. Thompson training a patient regarding arterial inflammation. You may have seen that that image a few times in my own videos. Now it's interesting. I've attended some of the seminars, heard people like Dr. Thompson speak, and one of the things that I heard was criticism of the dental community, of the portions of the dental community that actually focused on getting screening done. They said, well, you know, some of the folks and some of the dentists even felt intimidated by branching into this area of medicine. Makes no sense, and this is where I have to be careful that this doesn't turn into a rant. But I just got to make a couple of points here. Who's ever been to a YMCA? You get free A1C, hemoglobin A1C screening at the YMCA. Now, who's ordering those tests? Health coaches, fitness people. And nobody questions the YMCA doing screening for diabetes and heart disease. Again, more images around diabetes, chronic disease screening at the YMCA. So why the question and concern for dentists? If we can have people at the YMCA, fitness trainers, doing blood pressure, taking, actually even doing finger sticks for glucose and for cholesterol, then why in the world would we question a dentist for doing the same thing? Dentists are far more in touch and far more trained for doing exactly that. Okay, maybe I did avoid turning that into a rant, but that's my point. Dentists need to be far deeper into screening for heart attack, stroke, vascular inflammation, diabetes. They see it all day, every day.